Today is World Migrants Day, and we're looking at a very interesting aspect of it, particularly on the issue of exodus of Nigerians abroad, the impact on the medical profession. The national president of the Nigerian Medical Association in recent times has been shouting on rooftops that day in, day out, week in, week out, month in, month out, a lot of Nigerian doctors are migrating abroad to the point that the ratio, even though we have never really met the ratio of a doctor to specific number of patients, that gap is widening by the day. And of course, all of these borders on welfare, salaries, allowances, emoluments, conditions of service generally. With me in the studio is a labor devotee who's also been following all of this issue, Comrade Muni Mike Modesty Itwa. You can just call him M Cubed Itwa. Many thanks for joining us on the show.
Good morning, Duke.
Compliments of the season.
Same to you.
Merry Christmas.
Same to you.
Okay. Yeah, you've been following this issue. This is reminiscent of what happened sometime in the 80s, where you had a lot of Nigerian medical doctors going to Saudi Arabia, going abroad, and all of that. Is this just about welfare and condition of service?
Well, it's not all about welfare and condition of service. A lot of factors are involved. When you talk about immigration and emigration, there are a lot of things involved. Generally speaking, you discover that since the 80s, like you rightly said, people have always been migrating from their country to another country. It's not only in Nigeria, it's universal. But you know there are those countries that are the big ones that other people will want to go to. Unlike those days when Ghanaians will want to come to Nigeria. You know, due to the crisis here and there as a result of war, genocide and all others, people also move. But let's come to the professional aspect of it, like the doctors, our engineers, and many others. Yes, greener pastures, okay. For upgrade of education and training and orientation, facilities, infrastructure, and many other reasons. Paramountly, economic gains stands out as one of the major reasons why our professionals are migrating. Restrictively, let's go to the doctors. It has always been, and I think if you go around the entire world, Nigerian doctors are about the best, in quote. If you're in the United States of America, Nigerian doctors, they are present in virtually all clinics, government-owned hospitals. Even the ones they establish on their own, they are doing tremendously well. American presidents have had the services of Nigerian doctors. If you go to Saudi Arabia, in fact, all over the world, they are present. But the question you ask is, why don't they think of repatriating some of their acquisition back into the country? Unfortunately, you discover the atmosphere is hostile. You hardly will get anything in this country. Every day we pray for change, and the change is always on the negative side. We have leadership without political will to do the needful, to make the people think of how to come back home. Electricity is a major problem. Some of them are interested in coming here to establish first-class hospitals. But you cannot be thinking of establishing first-class hospitals when you are talking of issue of kidnappings everywhere. You are talking of the issue of Niger Delta, that insecurity is all over the place. And you cannot even be guaranteed of power supply.
Okay. So
a lot of factors. By now, they ought to have been bringing back to their motherland. But the motherland is not encouraging them either.
Okay.
Apart from the doctors, engineers, a lot of them. Our lawyers are good. So if you go to the whole of Africa, if you talk of lawyers, judges, who are well-renowned, they are from Nigeria. Nigerian judges are in many parts of Africa, heading Supreme Courts and some other courts.
Okay. Is it coincidental that this seeming shout about the exodus of Nigerian doctors abroad, it's happening now, and it's more pronounced now, which is reminiscent of what happened in 1980. Do you think it's coincidental?
It has always been there. It has always been there. If we are talking about Nigerian doctors, what about our nurses?
Okay.
We are beginning to witness massive movement because our nurses are everywhere in Canada. They're everywhere in the US. They're everywhere in Saudi Arabia. Our nurses, qualified ones, they go there, they take their test.
What is the impact of this on the health sector? Because that seems to be the crux of the matter.
It's depletion of human elements. Manpower is lacking. You can imagine, for instance, in the state government-owned medical center, you discover that you get there, you are seeing about 5, 6 doctors. And those who are on ground are not even getting what they ought to get. You are getting there, you are seeing nurses who are not well treated. But these people, they have the opportunity of moving outside the shores of this country, and they are treated as kings and queens. apart from the economic gains, the environment where they work, the infrastructure that is available. Here, you heard of Sadiq Daba recently. Sadiq Daba was moved to UK for the purpose of prostate cancer. And the revelations are all appalling now. That all the laboratory tests that were administered here, they failed the minimum requirement. Why did they fail the minimum requirement? Because what they ought to get to use, modern day technology, they don't have it. And that is a nationwide disgrace to this country. They don't have it. For instance, you have Lahore Laboratory in Benin City here, owned by Professor Malawa, former VC. Such an institution needs to be supported by government. There are people with this idea that we want to stay in here and do it and make it work in here. But once the spirit comes up, they're able to put in their 1 or 2 naira. Government support doesn't come. And you know, financial support from only one source most times cannot even do it. You are here now, we are talking in the studio, and you might be shocked that they're running a plant at exorbitant cost. So when the question of power supply is resolved, when the question of security is reduced to the barest minimum, you see the zeal, the political climate is in order, you see people will not want to move. A doctor, for instance, here, who earns, let's say a resident doctor, who earns about 150,000, equate that to a doctor in the rest of America who will earn about $60,000 or $70,000. Equate it. And you now think that such a resident doctor here finds an opportunity of migrating. He has to move. It is even possible he suffered all through primary, secondary, university before he got to where he is. And he knows he has gotten what is needed overseas. He finds his way, he vamooses. And before you know it, all his friends, they start going.
They'll follow suit.
They'll follow. A greener pasture. And you know the first element for every human being is comfort. And when you have comfort and there is peace, you are settled. Comfort most times will come from financial perspective. If you have no money, you have no peace. Though sometimes you can have money without having comfort, in quotes.
Yeah.
But most times, when you have this money, comfort comes. Every other thing you can always see how you manage the situation. Okay. So migration of our professionals will continue. Like in university, UBTH, many doctors, neurosurgeons and others have migrated. There are some specific fields in medicine today in Nigeria where we are having 1 or 2 all over the country. It is not as if we are not producing these people. We are having many of them overseas. But what is government doing to be able to lure these people to come back, give them comfort, give them security, and make them work for us? I tell you, Sonny, most of our guys who go abroad, when they get there, Nigerian doctors are there, the ones treating them there. They are there. In terms of those who have really made things work in the field of medicine in Africa and in the field of medicine in the whole world, Nigerians, they come within the first 3. They are there. They are revered and respected by the Oyibos. But here at home, a prophet is not known. So these are the issues.
All right, let's just expand that a little bit to look at the issues about plight of workers, welfare of workers. In recent time, there's been debates and discussions on what should be an ideal minimum wage for the Nigerian worker. Yeah.
If you ask me from the monetary perspective, money Mike Modesty will tell you, an ideal wage for the Nigerian worker, minimum, is 100,000 naira. But going to the other side of the same coin, you also ask me, I will tell you, maintain 18,000 minimum wage and make sure every other factor
works.
But are we sure every other factor will work? As I speak, there are some few states in the north that have not even paid 18,000 minimum wage. Then as we speak, 18,000 no longer pays for a self-contained boys' quarter. Then you expect a worker who earns 18,000 to take care of the medicals of the children and himself, to take care of school fees, to take care of feeding. In most cases, most of them don't even have up to 2 square meals. Let us even remove the word square. They don't even have to 2 meals a day. Then we go to the same market. Just imagine it. Even 100,000, let's evaluate it in the face of the dollar. You still discover it's still grossly inadequate. The stress in this country alone is killing. And I can tell you over 80% of Nigerians are having mental challenges. Knowingly or unknowingly. as a result of stress. And I'm telling you, you have to provide your water in this country. You have to provide the road that goes to your house in this country. You have to look for your food in this country. You have to power your generator in this country. Virtually everything, 99.999% of what you require, you have to provide by yourself. All by yourself. Government exists, yes, but we have since gotten it wrong. But what are we doing to start getting it right?
These issues, they've always been there. But are you saying that they are heightened now, even under the present administration?
Astronomically.
With all the promises made?
Astronomically.
Substantiate that.
Now, you that is seated here, you know how much you used to give to your madam to go to market before the coming of this administration. Is that the same amount? If, for instance, you are opportune to have up to 100,000 to give to your wife to maintain the family in a month now, in the real sense of it, can the 100,000 maintain you, your wife, and the children? Do you have other sources of income? Are businesses growing or they are closing up? They are closing up. Companies are closing shops. They can't produce. Even when they produce, the market is oversaturated with foreign goods. The manpower is not even there because companies are driving their workers. People are now more unemployed than it used to be. In fact, let me not really say assessing government. I'm telling you, I'm assessing this country, Nigeria, as it is today. I tell you that even somebody who earns 200,000 naira as salary, 200,000 naira compared with the enormous responsibility of extended family relations here and there, that you have to raise up your hands to make sure a cousin or a nephew or a niece goes to school. And you are told the school fees that used to be 12,000 is now about 120,000. How many more salary will you now get to be able to pull such an intelligent younger relation whom you do not want to get frustrated and also carry your own responsibilities? We live in a country where everybody is a brother's brother. Every sister is everybody's sister's sister. Your great-great-grandfathers, the lineage, everybody that looks up to everybody. We don't live in a country where people stay on their own to say, everybody carry your own cross, now you know. No, we are not. By nature, Nigerians are not trained like that. Africans are not. They are always their brother's keepers. But let's look at it holistically. We have all gotten it wrong. You and I, all of us, in one way or the other. We have contributed to the economic mess in one way or the other. The market woman who is in the market, who has a jar of or a keg, and decides to compress it underneath and sell at the same rate as if you're the normal, has caused trouble. The religious man who preaches in the altar and no longer gives value to those people who do what is right, but gives value to those people who stays at the front row because they will throw money into the church, he's wrong. The traditional ruler who no longer gives judgment as God has given him the wisdom to, because of financial gains, has also contributed. He who sits on the table in the office, whether you're a government staff or a private employee, you see that making 5% interest will be okay for you. You decide to make it 20% interest on the head of another person. It is also awaiting you from the other angle, because if he buys at such an astronomical rate, he goes back to say he will want his own. Yeah. Then the chain continues. You who have the possibility to preside over the people, and you know what is good for the people, you decide to line your pocket and line the pocket of your sons and your great-grandchildren. God's judgment is awaiting you. You, a little child, your father is able to send you to school to say, please go and do this. You use your school fees to take care of women in school and cry back home to say, oh, they have stolen my money. You may not know what you are doing. You are incurring the wrath of God. So we need a general reawakening. That is the truth. Okay,
value orientation seems to be the key here. But where will you start from? Because it looks like all of these that you've highlighted is at the doorsteps of leadership.
Not leadership per se. It starts from the family. Because if a child steals 1 naira and is not corrected while growing up, there is the tendency, the higher he goes,
the more he steals.
Or you just had a child who just graduated from school, from nowhere he brings in a limousine to the house. And you are busy clapping for such a child. When you know that that child has not worked anything that will worth that Rolls Royce or limousine, then you clap. Then you have told the child, continue in what you are doing. Now you know it's Yahoo Plus, and it's trending. Everybody wants this money, and nobody wants to work. Those who are even studying in school no longer even pay attention to their studies. It is hard to make this money and show to society that I have arrived. People are not using human beings as sacrifices just to be able to magically get somebody from abroad to send in thousands of dollars. You know the unfortunate thing. In most of the times, even the thousands of dollars, they don't even know how to spend them. Because any source that comes from the evil side, you wouldn't know how it goes. The repercussion is massive. And the implication is on all of us. So let's start thinking. The buck starts from the family. It starts with the religious organizations, whether Muslim or Christian. It starts from the traditional institution. Because every other product from these ones are the ones who migrate to every other discipline. We all belong to this ones. We belong to the family, we belong to the religious organization, we belong to the traditional institution. And if we get it right from 3 or 4, our educational system, then there's every tendency. But how soon shall we continue? Are we likely going to continue to rear a fresh breed of true Nigerians?
So it just seems like you've exonerated leadership in this whole discourse.
No, that's what I told you.
Yes.
The problem that comes from leadership starts with the family.
So we address it from the family.
If we address it at the roots, then we can be rest assured. And in the next 10, 15, 20 years, we shall be having crop of leaders. But as it is that leader who started stealing from the mother's pot. That leader whose community leaders told lie, who was at the village square and saw a traditional ruler, gave wrong judgment. And it stuck to his brain. Oh, this is the way of living. But today, he was in the church when the pastor saw what was good and said it the other way. He may have been a good mind, but because of what he has learned, consciously and unconsciously, he has grown with it. So if you are a council chairman and you have the opportunity of stealing 2 million, when you become a state governor, the cost is wider. And you want to loot, not minding whether there are people there or not.
Thank you very much, Moni Mike Modesti Itwa. It's always a delight to have you here because you just have a way of embellishing the whole discussion with the realities on ground. Well, 100,000 naira minimum wage for every Nigerian worker. But if we can't get that, let's continue with the 18,000 naira minimum wage and make all other things work. I mean, light, road, water, you just name it. But I don't know if that is possible within the context of Nigeria. Maybe not immediate, maybe not in the immediate, maybe years to come, maybe several years or hundreds of years to come. Let's look at what is doable right now, which is maybe adding more to what we have currently as minimum wage. But again, there are states who can't even pay the 18,000 naira minimum wage. Quite interesting. Moni Mike Modesti Itwa, many thanks again for joining us on the program TMI.
It's a great pleasure, Sonny, and I'm grateful to all those who have watched us this morning. God bless ITV. God bless all of you.
Thank you. Well, we'll take a short break.